Under Standing Order 29, welcome Tánaiste to the call on Deputy Derek O'Leary, please.
Thank you, Ken Curler. Tánaiste, we have fantastic people working in our health service. The outcomes for those that access it are generally very positive. However, 2018 has been marked by a number of incredibly tragic incidents that are still ongoing. With cervical check and the implications of that, and Deputy Alan Kelly hosted a very powerful meeting last night around some of the women affected there. We had the issue that I raised with you in November, highlighted by Justice Peter Kelly, about non-qualified doctors in our hospitals. And yesterday, we have the report from the analysis of the scans at Kerry University Hospital. And that found that 11 patients suffered delayed diagnosis, one of whom has passed away. And that person who passed away waited for 76 weeks, for 18 months, for a diagnosis of lung cancer. There were 44,831 X-rays audited and found to be correct. That's an important figure to remember. However, 1,298 X-rays had significant errors. 420 patients had to be recalled, and of that 420, 59 required further tests. And according to the report, these X-rays and the scans were read by a locum consultant who no longer works in the hospital and who resigned from the hospital in October 2017. Can you confirm, Tánaiste, that that person is not working in the Irish Health Service at the moment? There are currently, Tánaiste, on the broader issue, over 500 consultant positions filled by non-consultants. They're either locum or fixed-term or specified purpose contracts. That represents 16% of the total population of consultants, and there are further 199 unapproved posts. We have vacancies at therapist level, we have vacancies at nurse level, we have vacancies at GP level. Right across the health service, it is straining under the pressure of work being exacerbated by these vacancies. A key recommendation of the report yesterday, Tánaiste, was that we would define acceptable volumes of work for individual radiologists. And that surely is a concept that can be extended right across the health service. But how do you define acceptable volume of work for anybody in the health service when there are such vacancies and such demand? And the government is continuing to put its head in the sand about the impact of those vacancies on patient care, about the impact of those vacancies on people working in the service, and the pressure those vacancies are putting in already pressurised work environments. Tánaiste, do you accept that the vacancies across our health service are unacceptable? Do you accept that the vacancies are allowing doctors who are not qualified to hold on to positions to work in positions that they shouldn't be in? And are you concerned about the impact that these vacancies are having on the quality of care available, and the impact these vacancies are having on morale within those working within the health service?
Thank you, Deputy.
Thank you, Concur. 4 families have lost their loved ones because of this, and we don't know how many more in terms of the other 7. And yes, I join with expressing sympathy, but it's not good enough. We do that every time we have an incident, and that sympathy is heartfelt, but we don't learn from it. What we need to learn is that we don't do this, that this doesn't happen in another hospital. What we need to have is some sort of patient focus at the heart of government that actually says we're not coming into this chamber every few months and giving sympathy. We need action. And I've identified the recommendation from the report about what the report determines as acceptable workloads. And is that not something the government will take on board, implement across our health service at all grades, and give health professionals workloads they can manage, give them the support they need to do their job, and actually take a proactive role in filling the vacancies at every level? You cannot keep putting your head in the sand at our consultant vacancies, at GP vacancies, at nurse vacancies. We need proactivity to fill those vacancies, to take the pressure off our health professionals, and to avoid a situation, Tánaiste, where we come back to another expressions of sympathy. And finally, I repeat my question. Is the person involved in this case still working in the Irish Health Service?